Workplace violence against healthcare workers is not new, but today, finally, we have a chance to do something about it. They are 5 times more likely to be punched, bitten, beaten, choked, and assaulted on the job than any other worker.
Nurses are highly trained clinical professionals. We are not punching bags. We are not people who are willing to accept being stabbed, punched, bitten, pushed, shot, spit on, threatened, you name it. It happens everywhere, not just in the urban areas, suburban, but also in rural facilities. In any other profession, if someone were assaulted at work, it would be dealt with in the most serious manner, but for some reason in the healthcare field, particularly nursing, where the vast majority of the profession are women, workers are expected to absorb this violence, walk it off, and then they go home wondering, who's protecting me?
Right now, there is no current state law in Pennsylvania providing for workplace response and prevention efforts by health facilities. No current state law.
Hospital management's response to countless cases of workplace violence is often less than adequate.
This bill finally establishes violence prevention committees and gives frontline healthcare workers a seat at the table as they work together with management to develop a written workplace violence prevention plan. This bill creates training requirements for health facility employees at risk for violence. This bill creates reporting requirements for incidents of workplace violence and creates the possibility of fines and penalties for facilities that are found to be consistent bad actors.
Now, violence is not the fault of the hospitals, but the lack of response, remediation, and preparation to ensure that we have hospital policies and procedures and the equipment to prevent workplace violence is the hospital's responsibility. It is their fault when the system breaks down.
Today, we have a chance to give our nurses and other frontline healthcare workers what they are really asking for: a process to prevent workplace violence from happening in the first place, and a true process for reporting, investigation, and accountability when it does happen.